To set up a chest tube drainage system, you will need a chest tube drainage system, suction tubing, occlusive tape, hand sanitizer, clean gloves, and clamps. First, perform hand hygiene.
Go.
Open the drainage system packaging, open the drape, and place drainage system upright. At the patient end of tube, ensure the sterile cover remains intact. Next, you will need to inject the sterile water into the drainage system. Note, do not inject the water into the top. Inject it into the bottom port, as also illustrated on the packaging. Take the fluid-filled syringe and remove the rear packaging on the drainage system. Remove the cap off the syringe and inject the sterile water into the bottom rear injection port. Firmly press the syringe onto the port. Slowly inject the fluid into the air leak chamber up to the dotted line. You will see a small blue ball rise with the water. The small blue floating ball has a pigment on it that will turn the water blue, making it easier to assess for leaks. Remove the syringe and adjust the centimeters of water to the level ordered by the physician. The default setting is -20. Clamp the drainage tube with the included clamp. If no clamp is included, use a rubber-tipped hemostat or Kelly clamp. Remove other packaging and swivel open the base support. Perform hand hygiene. Apply clean gloves. When physician is ready, remove the cover from the end of the drainage tubing. Note, this end is now sterile. Hand it to the physician for them to connect to the chest tube inserted in the patient. Once connected, the nurse can be responsible to tape the connection with occlusive tape. After taping, place the chest tube drainage system below level of the patient's chest by hanging it on the bottom of the bed or placing on the floor. Now unclamp the drainage tubing and assure there are no loops, coils, or kinks. This completes the setup for the chest tube system to drain by gravity. If the chest tube is ordered by the physician to drain via suction, take the suction tubing and connect one end to the suction port on top of the drainage system. Attach the other end of the suction tubing to the wall suction. Turn the suction flow rate to 80 millimeters of mercury as per the manufacturer's guidelines. Use the dial to adjust the setting. You should see gentle bubbling in this chamber. Here, we see vigorous bubbling, which may indicate an air leak. First assess your patient, then begin troubleshooting techniques. You should also note the suction indicator inflate to the arrow.